So in this video I'm gonna discuss about most famous topic, which is potassium. Without knowing potassium you cannot take your exam, because on your exam there are high chances that at least 5 to 6 questions they're gonna ask you on potassium. So without knowing potassium it is impossible for you to pass your exam. So you must know about potassium. So I will try to explain you in simple words, and after this hopefully we're gonna do some practice question and answer, and you will see you will be able to get all of your answer correct immediately. So let's start. I will try to explain you in simple words, and I'm gonna only discuss about main points, so it's gonna be easy for you to understand everything about potassium. So first thing first, what is the symbol of potassium? So symbol of potassium is K, right? You must know about that. K plus is the symbol of potassium, and K is known as king of electrolyte. K is for king, and potassium is king of electrolytes. You must know. So the next thing is, what is the normal range of potassium? So the normal range of potassium you must know is 3.5 to 5.0. That is a normal range value for potassium. So how you gonna remember the potassium lab value? So how you gonna remember 3.5 to 5.0, right? So the next thing, how you gonna remember? There is a easy way to remember. So just imagine that one of your friend, his or her potassium is low, right? So now you are telling your friend to eat, hey, eat at least 3 to 5 bananas every day to increase your potassium. So now you know the potassium level. Potassium normal numbers are 3.5 to 5.0, and you're telling your friend to eat at least 3 to 5 bananas in a day to increase your potassium. So because in banana they say high potassium, right? So you will remember that way. Next thing, if the potassium numbers are below 3.5, then we call hypokalemia. Hypokalemia means low potassium level in the blood. And if potassium numbers are above 3.5, then we call hyperkalemia. Hyperkalemia means too much potassium in the bloodstream or in the body. You must know about that. Hypokalemia and hyperkalemia both are life threatening. So whenever they are talking about potassium, just think about heart, because if the potassium is low or if potassium is too much, it's gonna disturb your cardiac rhythm. That means the patient might develop cardiac dysrhythmia. You must know about that. So let's talk about hypokalemia. Hypokalemia means low potassium level in the blood. That means the potassium level below 3.5. So when this happened, what would be the nurse priority? So the first nurse priority is going to be put the patient on cardiac monitor. That's the first thing you're going to do. Put the patient on cardiac monitor to check their heart rhythm, because their potassium level is less than 3.5. So we will see alteration in the heart rhythm. So in your exam, they're gonna ask you question on ECG about hypokalemia. So in hypokalemia, what happened? The T wave is flat and ST depressed. So T is flat and ST depressed. That thing you must know for your Nclex about ECG rhythm. Another way you will remember this. So let's say in hypokalemia, the potassium drop, right? So that means T is gonna be drop and ST depress. So how we gonna fix the low potassium level? So what we gonna do, the intervention is gonna be, the doctor is gonna prescribe potassium tablet or potassium solution. So if patient can take medication by mouth, then we will give potassium tablet, and we have to tell the patient do not chew, and you cannot crush the potassium tablet. You have to tell the patient to take medication with a full glass of water after meals. After before, because if you give before meals, it's gonna disturb the GI tract. So you have to tell the patient do not chew, or do not chew and do not crush the potassium pill. You have to tell the patient to take whole pill and swallow, and then drink full glass of water after the meal. And if patient is on G-tube, cannot take by medication by mouth. In G-tube, the potassium is come in a liquid form, so you have to give like 20 MEQ or 40 MEQ, like 2 days. It depends on the doctor what they want to prescribe. So mostly the doctor prescribe give 40 MEQ, 2 doses for 2 days. So that's how you're gonna increase their potassium. And once you give this potassium tablet, the next thing the doctor is gonna order, check their BMP or CMP lab after 2 days. to see their potassium is up or down. So during your exam, if they give you four options, CMP, or they're gonna give you only one. Either they're gonna give you CMP or BMP. CMP means complete metabolic panel, and BMP is basic metabolic panel. Both labs read the potassium level. So either choose one. CMP has little bit more lab values than BMP. BMP has little bit fewer. So, but BMP will also read your potassium level, and CMP also read your potassium level. So that's how we're gonna increase the potassium if they have low potassium in the bloodstream. Another important thing is if the doctor prescribe potassium via IV, then you cannot push the potassium. You cannot. The potassium is only given in the diluted form via infusion. Only given in diluted form via infusion. And in order to give potassium, you need more than 1 hour to administer the potassium. And 20 MEq per liter is the recommended dose. But in critical cases, the doctor would prescribe 40 MEq per liter. But you have to give the 40 MEq over 1 hour. So during your exam, first of all, you cannot go more than 40 MEq. If in your question, if you see the doctor prescribe 50 MEq, what would nurse do? So nurse would always ask the clarification from the doctor, because 20 MEq is recommended, but in critical cases more than 40 MEq you cannot go. You cannot cross more than 40 MEq. So 40 MEq is your cutoff in critical cases. So if the doctor prescribe 50 MEq, then you have to question the doctor, and you have to give in more than 1 hour. You can, if the question says the doctor prescribe 40 MEq, give over 30 minutes. No, you cannot give over 30 minutes. It has to give more than 1 hour. So you always question the doctor. And when you are giving potassium over 1 hour, again the patient must be on cardiac monitor to check their rhythms all the time. So that's about the hypokalemia. Now let's switch it to hyperkalemia. Hyperkalemia means when the patient potassium level is more than 5.3. If the potassium level is more than 5.3, the lab value come under C category. And if the patient potassium lab value is 6 point above, that means the patient category come as a D category, and both are medical emergency. If the potassium level is 5.3, the nurse needs to be in the bedside. The nurse can run here or there and do her job. But if the potassium, that's called category C, the nurse can still run here or there, can do the job. But if the potassium level is 6.0 or above, that means the nurse cannot leave the bedside at all. So the nurse needs to stand there with the patient, needs to be there all the time, and the nurse can command like, help me with bring this or this or that, but the nurse cannot leave the bedside if the potassium is 6 point above, because that is a critical situation and anything could happen to the patient, you must know. So when the potassium is high, what you gonna do? The priority is gonna be whatever the potassium you are giving to the patient, you have to hold all the potassium. That's the first thing you gonna do, hold all the potassium. So what changes are you gonna see on cardiac monitor on hyperkalemia? So what we gonna see, as the potassium is increasing in hyperkalemia, the T wave is gonna be also peaked. The T wave is gonna be also peaked, and followed by elevated ST wave. In the hypokalemia, as the potassium was dropping, the T wave became flat and depressed ST, right? But in hyperkalemia, as the potassium increasing, the T wave is going to be peak, followed by elevated ST, You must know about that. So what doctor gonna do in this situation? So there are chances that doctor is gonna start with Kexilade. Kexilade will help to decrease the potassium level, as patient is gonna have bowel movement and potassium will exit through your body. That's the first step doctor could start. And if the potassium is more higher than 5.3, the next thing is gonna be you have to give insulin with dextrose. That's the next thing, you have to give insulin with dextrose. Why insulin with dextrose? Because let's say this is my cell and all your potassium is in your bloodstream, right? So this is the cell, right? And this is insulin. So the insulin job is to open the cell, right? Like that, right? And insulin also binds the potassium. So insulin will pull the potassium and insulin will take all the potassium in your cell. So that's called intracellular potassium. As far as potassium is in your cell, you don't have to worry, but it should not be in the bloodstream. So that's the purpose of insulin. So you will take insulin and potassium, they will go inside the cell. That is totally fine. It should not be in your bloodstream, but it is okay to be in intracellular. So that's the purpose we are giving insulin with dextrose. So that's why we are giving insulin with dextrose, because insulin metabolizes glucose, so carbohydrate. And when insulin is going into the cell, insulin pull carbohydrate, glucose as well as potassium. So they all go combined together. So that's the purpose you are going to give insulin with dextrose. And in most critical situation, the doctor during your exam, if you see what thing you're gonna give first, are you gonna give insulin with dextrose or you're gonna give calcium gluconate? So the priority is gonna be calcium gluconate. The reason you're gonna give calcium gluconate, because you want to protect the heart membrane. Once the heart membrane is stabilized, then you can give insulin with dextrose, right? So that's the wrap of our potassium, and that's the only thing you need to know about potassium. So now let's do practice question and answer, and you will be able to get most of your answer correct immediately. Let's practice. So here is the first question. The nurse is reviewing a client laboratory result and notes the serum potassium is 2.8. Which nursing action should be initiated immediately? So when the potassium is low, what the first thing you have to do? You have to put the patient on cardiac monitor. So initiate cardiac monitoring. That's the first step. Easy, huh? Next question. A critically ill patient lab result shows a potassium 2.8. Which complication is most concerning in the patient? So when we are talking about potassium, you have to know they are talking about heart rhythm. Anything related to potassium is they are talking about heart rhythm. So where is the heart rhythm in this one? So ventricular tachycardia, you will see that one. Anything about potassium related to heart. So you have to know ventricular tachycardia. Which ECG changes in seen in hyperkalemia? Hyperkalemia, what we see? We see as potassium increase, the T wave increase followed by ST elevation. So peak T wave, option B is your final answer. A client with hyperkalemia, potassium is 6.8, is admitted to the emergency department. The client report muscle weakness and ECG show peak T waves. Which medication should the nurse administer first? So you have to administer calcium gluconate IV, because you have to stabilize the heart membrane, and then after that followed by you can give regular insulin with dextrose. So option B would be your final answer at this time. A nurse is caring for a patient with hyperkalemia 6.2. Which ECG change is expected? So hyperkalemia, what we see? We see tall peak wave. We see tall peaked T waves. So option B is your final answer. So I hope you will be able to crack most of your answer when you see anything about hypokalemia and hyperkalemia, right? Good luck.